At this very moment, 1 in nearly 40 Americans is utterly paralyzed by the need to perform an irrational ritual. They wash their hands repeatedly, lock the door 5 times, count to 7 before entering a room, just to get through the day, or even the hour. They suffer from obsessive-compulsive disorder, a crippling anxiety disorder. OCD is twofold: unwanted recurrent thoughts that will not go away, the obsession, and repetitive actions performed to stop the anxiety, the compulsion. While OCD sufferers know their behavior is often irrational, they cannot stop it on their own. They're often ashamed, embarrassed, or even unaware that they have a treatable disorder at all. And unfortunately, OCD is easily mistaken for something else. It's confused with depression, bipolar disorder, or ADHD. On average, it takes 9 years after onset for an accurate diagnosis. Would you know if you or a loved one was suffering with OCD? Do you know what the signs are? The answer could change your life. Here to help us understand this condition is Dr. David Tolan. He's the director of the Anxiety Disorder Center at the Institute of Living. So, Dr. Tolan, who's at greatest risk for this very perplexing problem?
Well, Dr. Oz, the #1 risk factor is people with a family history of OCD. We know that there's a very strong genetic component. It seems to affect men and women in about equal numbers, although boys seem to develop this disorder earlier, whereas girls tend to develop in later teenage or even early adulthood years.
Now, I've always been fascinated by this because it seems like it's a sort of a kink in the normal machinery of the brain. So let me show you an animation of how the brain processes information. And we're just beginning to learn this now. So deep inside the brain, there's a place called the worry circuit. It's where we all think about things, and it takes us from the prefrontal cortex, the very front part of our brain, deep inside the brain, to an area called the caudate nucleus. That's the red area here. This is the cingulate gyrus. The names are unimportant, but they're now the frontier of where we now understand. We figure out the consequences of our actions. We form habits because of that, because we predict the future. It's wonderfully effective in living life. But what if it short circuits? And what are the kinds of symptoms that we would identify as physicians or healers if we see folks having these problems?
Well, there are 2 main symptoms of OCD. The first is what we call obsessions. These are unwanted thoughts, ideas, images, or impulses that come into the mind again and again, and the person can't get rid of them. And so one of these might be, for example, an excessive preoccupation with dirt or germs or contamination, an idea that everything is germy and going to hurt you. Another might be an excessive worry about harming other people, maybe by making a mistake, such as leaving the oven on, or maybe on purpose by doing something violent that they don't mean to do. Another might be a need for things to be ordered or symmetrical or lined up just so that everything has to be perfect, otherwise things feel like they're out of control. And then there are some people who have obsessions that are personally repugnant sexual or religious or violent thoughts or images. These are the obsessions.
And so you can see why this worry circuit that I was speaking of earlier has some elements of sanity to it, and unless it goes off the far end. And then these obsessions develop into related compulsions. You've got to do something to address them.
The compulsions are the behavior that the person does more or less on purpose as a way of trying to neutralize the obsession or to somehow make things safe. And so one of those might be an extreme cleaning or washing behavior where the person has to wash their hands again and again and again to try to neutralize their fears of contamination. Other people might need to check and recheck things over and over again, so if you're afraid that you've left the stove on, you have to keep going back to check it. There are some people who engage in excessive ordering or arranging behaviors, so if they are worried that things aren't symmetrical or lined up, they have to keep physically rearranging things. And then there are some people who also engage in what we might call a mental ritual, praying or counting in one's head, doing something again and again and again to try to feel better.